Welcome to the Tobacco Online Policy Seminar, TOPS. Thank you for joining us today. I'm Brad Davis, a postdoctoral research fellow at the University of Missouri. TOPS is organized by Mike Pesco at the University of Missouri, C. Shang at The Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hartman-Boyce at University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available along with presentation slides on the TOPS website, tobaccopolicy.org. I will turn the presentation over to today's moderator, Michael Darden from Johns Hopkins University, to introduce our speaker.
Thanks, Brad. Today we continue our winter 2026 season with a single paper presentation by Nita Mukand entitled Effect of Tobacco Sales Bans on Retail Sales in Beverly Hills and Manhattan Beach, California. This presentation was selected via a competitive review process by submission through the TOPS website. Nita Mukand is a PhD candidate in epidemiology and translational sciences at UC San Francisco. Her current research focuses on tobacco control policies and tobacco use in persistently impoverished areas in California. She completed a PharmD/MBA at the University of Illinois at Chicago, where clinical rotations in pulmonary and oncology settings spurred an interest in the harms of tobacco and its roles in perpetuating health inequities. Her previous research used cancer registry data to identify racial and ethnic disparities in cancer care and outcomes. Justin White, an associate professor at Boston University, is a co-author on the study and will answer select questions in the Q&A. Nita, thanks for presenting for us today.
Hi, thank you so much for having me. Is everyone able to see? Thumbs up would be appreciated.
Yes, if you could just speak up as loud as you can, or turn up the volume a little bit. Thanks.
Yeah, thank you. So my name is Nita Mukand. I am a PhD candidate at the University of California at San Francisco, and I'd like to thank the Tobacco Online Policy Seminar leadership team for the opportunity to present the first in the nation tobacco retail sales bans in Beverly Hills and Manhattan Beach. This research was funded by the California Department of Public Health California Tobacco Prevention Program. The findings and conclusions of this work are those of the authors and don't necessarily represent the views or opinions of CDPH or the California Health and Human Services Agency. My training was supported by a T32 from the National Institute on Aging, and I have no other competing interests to disclose and have never received funding from the tobacco nicotine industry. The data used in this analysis requires the following disclaimer, which is that the results and conclusions are those of the researchers and do not reflect the views of Nielsen IQ. I'd like to thank my co-authors, Elizabeth Anderson Rogers, Rafael Colonna at the California Department of Public Health, Wendy Max at UCSF, and Justin White at BU. I'd also like to thank my dissertation committee, and especially Justin, for their support in conducting this research. This analysis was published this past November in Tobacco Control. On January 1st, 2021, two cities in LA County, Beverly Hills and Manhattan Beach, became the first in the nation to ban the sale of all tobacco products, including e-cigarettes. Both cities offered retailers a 1-year hardship exemption and conducted outreach to individual retailers. Beverly Hills also included a permanent carve-out for 3 existing cigar lounges and offered small businesses consulting services. Additionally, Beverly Hills planned a city council review of the impact on tourism after 3 years. These laws are enforced by relying on public comment and sending inspectors to look for tobacco products, and non-compliance would result in civil penalties from city prosecutors. But this policy is not without precedent. Bhutan banned the sale of commercial tobacco from 2004 to 2020, and during the COVID pandemic, South Africa, Botswana, and India implemented temporary bans. Last year, 2 cities in Marin banned the sale of tobacco products, and though there were no retailers in those cities, the law will prevent future tobacco sales there. Also last year, to protect the coastal environment, Santa Cruz banned the sale of tobacco products with plastic tips or filters. In addition to sales bans, tobacco-free generation laws, or nicotine-free generation laws, annually increase the minimum legal sales age such that anyone born after the cutoff will be unable to purchase commercial tobacco products. These have been implemented by 21 cities in Massachusetts, starting with Brookline. In the Maldives, those born after January 1st, 2007 will no longer be able to purchase commercial tobacco, and a nicotine-free generation law just passed in the House of Lords this Monday. It includes a clause that adults who purchase nicotine products on behalf of children will face a fine. These are just a few examples of tobacco endgame strategies, which also include retail licensing restrictions, which limit the number or location of tobacco retailers, which stores can sell tobacco products, price increases, product restrictions, and advertising restrictions. This groundbreaking policy has already been the subject of published research. A secret shopper study by Henriksen and colleagues found that 81% of Beverly Hills and 94% of Manhattan Beach retailers were compliant with the ban. And in a 2023 study by McDaniel and colleagues, minimal difficulty in sales losses were reported by large chain stores, whereas smaller stores reported losing revenue and customers. This is the first quantitative study of the economic impacts of the ban. Our objective was to estimate the effects of the tobacco sales bans on retail sales in Beverly Hills and Manhattan Beach, which will be referred to as the treated cities. The primary outcomes were overall tobacco sales and tobacco sales by category, which included cigarettes, cigars, smokeless tobacco, and electronic nicotine delivery systems, which includes e-cigarettes. We also included aims that address possible consequences of the ban. These included estimating tobacco sales in the areas surrounding Beverly Hills and Manhattan Beach to determine whether the tobacco sales that would have occurred in the treated cities were displaced to the surrounding areas. We also estimated sales of non-tobacco products in the treated cities and surrounding areas to ascertain the broader economic impacts of the ban, and especially whether shifts in tobacco purchasing were accompanied by other spending changes that might impact local retailers. For example, if people are buying tobacco less often, are they purchasing other products less often too? Or are they spending more money on non-tobacco products because now they aren't spending their money on tobacco? This analysis leveraged Nielsen's retail scanner dataset of store-level information on individual product sales. These data are generated from Universal Product Codes, UPCs, and point-of-sale systems. UPCs are commonly known as barcodes and uniquely identify retail goods. The data was collected from a subset of large retail, grocery, drug, and convenience store chains that pre-approved sharing their store-level data, which included store addresses. This dataset covers approximately 16% of California's cigarette sales, and we use Nielsen's categorization of tobacco products, which includes cigarettes, cigars, smokeless tobacco, electronic nicotine delivery systems, which includes e-cigarettes. Our analysis included sales data between April 1st, 2018 and December 31st, 2022, which covers 32 months prior to the ban and 24 months after the ban, and it also precedes California's statewide restriction on the sale of flavored tobacco. The data were aggregated to quarterly sales, and we use the sum of the sales of all tobacco products to create a combined all tobacco category. To estimate the effect of the bans, we compared store-level unit sales of tobacco products in Beverly Hills and Manhattan Beach with counterfactuals comprised of tobacco sales in a weighted subset of California stores not in the bordering areas. Additionally, stores that contributed to the counterfactual were matched based on treated store type, which included drug, grocery, and convenience stores. We used synthetic difference in differences, which is a state-of-the-art causal inference technique that was first introduced in 2019. Synthetic difference in differences is a new quasi-experimental approach that's a hybrid of two different methods, synthetic control and difference in differences. It's appropriate for panel data, also known as cross-sectional data. Like standard difference in differences, synthetic difference in differences includes two-way fixed effects for unit and time. The unit fixed effect, in our case stores, allows for each unit to have a different intercept and accounts for stable unit characteristics such as a city's tobacco use norms or tobacco retail environment. The time fixed effects account for period-specific shocks that affect all units the same. Examples would be statewide tobacco policies like the flavor restriction or the onset of COVID-19. The synthetic control method takes a weighted average of the outcomes in cities that could potentially serve as comparators, driving weights that produce the best match in pre-policy outcomes and other prognostic factors that we adjusted for. And synthetic difference in differences makes use of the time and unit specific fixed effects in difference in differences, incorporates unit specific weights from the synthetic control method, and adds time specific weights. And these time specific weights balance out the control group, making the parallel trends assumption upon which the validity of difference in differences rests more plausible. Furthermore, synthetic difference in differences yields more precise and less biased estimates than either approach alone. The equations presented here will hopefully clarify what was explained in the previous slide. So on the left, difference in differences, two-way fixed effects regression with a unit fixed effect shown as alpha in the blue circle. On the right, synthetic control creates a weighted average using unit-specific weights, which is estimated omega in the yellow circle. This allows the synthetic control model to upweight controls with the most similar pre-treatment trends in the treatment to the treated group, which is necessary for the difference in differences approach. And then at the bottom, you can see how synthetic difference in differences incorporates these elements with the addition of the time-specific weight, estimated lambda, in the green circle. Our model included store and year quarter fixed effects and store type and whether there was a local flavored tobacco sales restriction as covariates. We also performed a synthetic difference in differences event study to test pre-policy balance and see how the effects of the policy changed over time. To assess the effect of the ban on retail sales in the surrounding area, we analyzed data from stores of the same type within a 30-minute drive of Beverly Hills and Manhattan Beach, which is a similar amount of time to the average commute for both cities per the 2023 American Community Survey. The GeoAppify's Isoline application program interface was used to identify stores in the commuting area. Similar to the primary analysis, we used synthetic difference in differences with matching by and adjusting for store type. Beverly Hills is shown on the left and Manhattan Beach is shown on the right. As you can see, both borders include the other treated cities, which was omitted as a possible synthetic control in these analyses. To determine whether stores in the treated cities lost business to those in the surrounding areas that did not have tobacco retail sales bans, we estimated the total dollar sales of non-tobacco products in the treated and border areas using synthetic differences. The non-tobacco sales included sales from all store departments except for alcohol and pet supplies, which are licensed separately. We used a permutation-based approach to estimate the confidence intervals for the synthetic differences model. This involves dropping the treated units from the data and randomly assigning controls to serve as treated units. This new data structure is then used to generate 100 placebo estimates and calculate a variance. In addition to the main analysis, we conducted the following sensitivity analyses, which are included in the manuscript supplement. A pre-ban test of trend fit using the root mean squared prediction error, a leave one out synthetic differences where we sequentially re-estimated the model while excluding each donor city, as this approach helps to identify whether the results were driven by poor treatment fit in any particular donor city. We also performed analyses incorporating an alternative, smaller definition of the border area that was limited to neighboring zip codes. An analysis to account for possible purchasing changes in package size by estimating dollar sales was performed, and non-tobacco sales were also analyzed by store type and store department. And before moving on to the results, take a moment for questions, a few moments.
Thanks so much, Nita. We're going to pivot to our discussant today, who is Adam Leventhal from the University of Southern California, for some questions and comments.
Hello, everyone. Yeah, thanks for having me. And this is really interesting, important, and highly rigorous study. I'll spend more time maybe towards, after we see the results and discussion, talking a little bit more about the conceptual things. I'll call out just a couple of methodological questions that Dr. Mukand, you can just expand upon a little bit. Just for clarity purposes, I think you mentioned sometime that your data set represents 16% of California's total tobacco sales. Can you unpack that and explain the context of what that means a little bit more?
Absolutely. And I will go back to the slide that focuses on the Nielsen data to better illustrate that point. So the way this data works is that Nielsen licenses their data that they obtain from stores to be used for research purposes. And it would be infeasible for them to do so with every mom and pop, corner bodega. And so unfortunately, it's limited to big chains. And in California, there's been a study, I believe it was tax-based. Justin, maybe you can weigh in later, that estimated how much of sales were captured in this data. And so it's the best data available to do this analysis, but it is limited to these big stores. And, we acknowledge that the conclusions aren't necessarily generalizable to independent stores, online sales, liquor stores that aren't included in this data set. That's a really important point. Thank you, Adam.
Sure. Okay. Well, maybe we could talk later, but whether you have an estimate of a little bit more narrow about Beverly Hills and Manhattan Beach, and they may be representative or non-representative of the statewide distribution of tobacco retailer types.
Yeah, that'll get addressed in the results.
Sounds great.
Definitely important.
There are a few questions in the chat that I want to just raise. Justin is actually doing a remarkable job of answering questions on the fly here. So one of the concerns with a total ban is always the kind of black market opportunities. And one question was the extent to which you've thought about that, and perhaps you could look at law enforcement data to see to what extent there was kind of that stuff going on or that stuff increased during this period.
Yeah, so we're not able to measure that, though as it relates to illegal sales if they were to be conducted by stores in these municipalities. There is clearly on the Beverly Hills and Manhattan Beach municipal websites numbers to call to report them, and there would be civil action against them if they were identified. And there was recently civil action against a large chain of tobacco retailers in LA that had been breaking the flavor ban. So it's not that there isn't any interest in going after businesses that flout the rules. So should there have been any illegal sales through these stores, I think they would have.
I think the spirit of the question is more on the black market for cigarettes themselves. So the sale of cigarettes outside of any formal establishments, so informal markets.
Yeah, I mean, it'd be great if there were data to measure that, but things that happen outside of, like
Well,
tax measured,
yeah, the suggestion was perhaps to use law enforcement data.
okay. I mean, we could look into that. I don't know. I mean,
So if I could maybe just jump in on that, I would say that I think that there are data on product seizures, for example, that might be used, but I'm not sure that they are released on the local level. But at any rate, our data and what we're reporting on are only tax paid sales. So it is a good point.
Yep. And then one other question, which Justin commented on in the chat already, but I'll ask you as well, Nita, just to think about, like, a lot of people buy their cigarettes at gas stations. And so what do you think about the absence of gas stations in your data in terms of your results?
Convenience stores are those that are or are not attached to gas stations. So I believe it captures gas stations.
Oh, so it does capture. Okay.
Yeah.
Okay, great.
Yeah.
Okay, great. All right, well, let's move on then and see the results. So great work so far.
So the first slide addresses your question, Adam. It was a good one. So see, I'll start with the descriptive statistics. So the Nielsen IQ data included 2 tobacco retailers in Beverly Hills and 5 in Manhattan Beach. But their border areas include over 250 stores in 387 cities and 300 stores in 350 cities, respectively. While not directly related to this analysis, per McDaniel and colleagues, 3 stores were reported to have closed in Beverly Hills and 1 in Manhattan Beach in the 18 months following the ban, though the authors couldn't determine whether the closures were due to the ban or other factors. These graphs depict trends in tobacco sales as a percentage of mean sales prior to the ban. The implementation date is indicated by the dashed black line. On the left, prior to the ban, there was a spike in tobacco sales in grocery stores, which may reflect stocking up in anticipation of the ban taking effect. Within our sample, tobacco sales ceased within 3 months in Beverly Hills and within a year in Manhattan Beach, indicating full compliance in our sample stores. This graph shows the results of the primary synthetic difference in differences analysis of unit sales of all tobacco by store before and after the ban. The treated cities, Beverly Hills and Manhattan Beach, are shown in red, and their synthetic controls in blue. As you can see on the left-hand side of each graph, the treated and control stores exhibit parallel trends, meaning the unit sales per store in the matched comparator group provide a reasonably good fit for the results in the treated cities prior to the ban, which is necessary for these results to be valid. And on the right-hand side of each graph, sales in the treated city, again shown in red, drop precipitously, reflecting the end of tobacco sales in both areas. This graph shows all tobacco sales by store before and after the bans in the border areas. Here, border areas are shown in red, their synthetic controls in blue. Both graphs also show very good pre-trend matches. And if tobacco sales had been displaced to the border, we would expect to see higher post-policy sales trends. But the observed lower trend is a strong indicator of no increases in cross-border shopping. This table shows the estimated effects of the bans on tobacco purchases in the border areas for all tobacco products and by product category. The sale of all tobacco decreased in both border areas, though the difference was not statistically significant for the Beverly Hills border area. And cigars were the only product category with increased sales in the border areas. These four figures depict the results of the event studies of the all tobacco results. In the treated cities, shown in the upper two panels, the sale of tobacco decreased precipitously. And there was no detectable increase in the sale of all tobacco in the border area, as shown in the lower two panels. These findings in the border area indicate a lack of evidence of cross-border shopping. Here, we have the event studies for the non-tobacco sales analyses. As you can see in the top panels, dollar sales of non-tobacco products did not decline in Beverly Hills, but decreased non-significantly in Manhattan Beach. Furthermore, there were no statistically significant changes in dollar sales of non-tobacco products in the treated or border areas when compared to the time before the sales ban. This suggests that stores didn't experience detectable changes in the sale of non-tobacco products after the ban took place. So any changes in foot traffic or substitution away from tobacco didn't affect their bottom line. The sensitivity analyses indicated that there was a close pre-ban fit such that the root mean squared prediction error was within 7.6% of the pre-ban mean, or 0.1 standard deviations. In our next sensitivity analysis, we tested whether one comparator unit was responsible for our estimates by conducting a leave one out analysis, and found that our results didn't change when we dropped one unit at a time. The effect of the bans in the adjacent zip codes was similar to those observed in the larger border areas used in the primary analysis. And an analysis using dollar sales as the outcome yielded similar results as the analysis using units, suggesting that package size switching was unlikely to be a major concern. And there were also no differential effects by store type. Let me acknowledge some limitations of our analysis. It was restricted to major chains, as Nielsen does not have contracts with small businesses to collect their point of sales data. We lack information on independent stores, tobacco specialty stores, liquor stores, and online sales. Consequently, our results may not be generalizable to these stores. Additionally, the number of treated stores in Beverly Hills and Manhattan Beach is small, but the estimated effects come not only from those stores, but also the very large donor pool. So more than 1,200 stores for Beverly Hills and more than 2,100 for Manhattan Beach contributed positive weight to the synthetic controls. We also don't have a means in this data set of measuring illicit tobacco sales, and any inference we would seek to make on tobacco use is limited by the fact that purchases are an imperfect proxy for tobacco consumption. Key takeaways from this study include that stores complied promptly with the tobacco sales bans, confirming Hendrickson's findings of high compliance. As shown in the pre- and post-policy store-level figures, tobacco sales quickly dropped to zero. When analyzed as a group, tobacco sales did not increase significantly in the border areas with the exception of cigars, demonstrating a lack of cross-border shopping. And Beverly Hills and Manhattan Beach retailers' fears of lost sales due to the ban were not borne out in statistically significant differences in the dollar sales of non-tobacco products evinced in the event study results. This study has important implications for policymakers by demonstrating a proof of concept and feasibility of tobacco sales bans. Tobacco sales bans, though, are just one tool in a larger toolbox of tobacco retail endgame strategies, which include the nicotine-free generation, tobacco retail licensing restrictions, which limit the number or location of tobacco retailers, which types of stores can sell tobacco products, price increases, product restrictions, and advertising restrictions. Additional experimentation will help researchers evaluate the impact of these policies, as Beverly Hills and Manhattan Beach may not be representative of other cities in California or the US as a whole. Thank you for listening. Happy to answer questions. And if any should come up later, you can contact me or Justin.
Thanks so much. That's a really terrific presentation. Very clear too. It was great. There's been a really active chat in the Q&A. So thanks to everybody, and thanks to Justin for his hard work there. We'll switch to Adam Leventhal from USC to provide some comments and questions.
Sure. Yeah, great presentation, Nita. Obviously, like a really rigorous and important study of a policy where there's not a lot of opportunities to do these types of evaluation studies. So kudos to you and your team for capitalizing on this opportunity and addressing it. I think some bigger picture issues about sales bans. I think like in some senses we kind of start thinking about prohibition and kind of as an extreme, this is like an extreme policy tool, right? And it brings up some of those concepts that people might have, and your study really does a great job at showing and rigorously evaluating the potential collateral unintended consequences, which didn't seem to arise at least according to your data, with the exception of the cigar increase and the neighboring locations, but that seemed to be on the whole, from a public health impact perspective, probably a modest that may not have outweighed the positive impact. Although there are, of course, other potential issues that couldn't be addressed in your study, as you mentioned, right, about the non-legal market. I think one thing that's interesting about this type of a policy is a lot of policies in tobacco control can be ambiguous sometimes. So, flavors, right? What is a flavor? What is not a flavor? California has had quite a time trying to clarify what that is. I think with a sales ban, it's pretty clear, right? I think retailers have a good idea of what they need to do. Um, so I think that's another interesting aspect of this policy that sets it apart from others. Um, I think some issues to consider in the future, um, like any types of study like this, when we're using sales data, it's always interesting to think about the correlation between sales and actual use in the population. And so, if you do show a reduction in sales, to what extent does that impact the person level topography of tobacco use? Do we see like some people maybe using more and accounting for, or maybe there's not as big of an impact on the total number of the population who use tobacco products, but maybe the frequency or amount that they use goes down. Those are the types of questions that kind of come up, but that's why we have a big field of tobacco control to triangulate. And I think across different types of research methods. So some interesting future directions, and I'm not sure whether this is planned, is there a possibility for doing a survey of residents in these areas and taking a look at their tobacco product use? Or is there any data that's previously existing? Um, and like the kind of final few bigger picture comments I'll make. Is I think one of the issues you brought up was maybe your data set didn't have alcohol, if I understood correctly. So it's always like an intriguing question with these types of studies, right? Is whether, you see a substitution effect and people using more of another psychoactive agent, or a complementary effect, which would mean that, in this case, they would use less alcohol. Same goes for cannabis. right? Especially in this environment in Southern California, where cannabis policies seem to be becoming less restrictive and there's more products available. And then kind of the final question and kind of point to make is uh, it's such an interesting policy. I don't know, and maybe our health economist experts may have some good ideas here, but do we have a comparator, right? Like for another type of a product that where a policy happened and we could use those data and kind of that experience to think about how it might apply to tobacco control and this policy. So I don't know whether there have been sales bans of other products and if there's lessons learned from that also, and then relatedly, how much will this simulate when you have a sales ban for a few, like two communities in a very like densely packed population versus if a state or a county, like a large county like Los Angeles County, which has 10 million people, were to have a policy like this, would we see a totally different set of results or not? I don't know. But your study did a great job at looking under every potential rock possible and giving us the best clues available as to what we can anticipate. So thank you, Nita, for your excellent study and great presentation.
Thanks, Adam. It seemed like there were several questions in there. I'll do my best to address all of them, but should I omit any, please just remind me to address them. One that is of particular interest is whether there's survey data to indicate if there's any changes in smoking in response to these policies. And this was part of my dissertation, so my involvement is somewhat finite, but I wondered if CHIS, the California Health Interview Survey, because they collect a lot of data on tobacco use and they tend to collect it like a high density of sampling, like much more so than Burfus, might be a good source of data to look at the consumption of tobacco products in these cities and around these cities before the bans and subsequent to the bans. Regarding a product that has also undergone a ban that could be compared to tobacco sales bans, I can't think of anything that comes to mind, but I'm not an economist. And so if anyone else does think of a good comparator, I'd be really interested to hear that perspective. Let's see, your additional questions. Oh yes, the substitution with liquor and tobacco and other psychoactive substances. Yeah, it's a function of the way the data is collected, and it's unfortunate, but it's the best data we have. So while it's disappointing to be able to give an incomplete picture, I think this is a great start to the research on these policies because, at least in our sample, there was no evidence of considerable economic changes for stores in the cities that implemented the ban, such that policymakers in future might be concerned about economic consequences in whatever future municipalities, counties, states are looking at policies like these. And Adam, what am I missing?
No,
What did
no, I think you hit the high points. So thank you. I really appreciate it. Great job.
all great comments and questions. Thank you.
Several questions in the chat. One of them, is kind of impossible to answer, but is always asked, and so I'll have to ask it as well. You have two extremely outlier places in the United States here, in Beverly Hills and Manhattan Beach. What do you think about the external validity of your results? If you were to do this in a less densely populated area or lower SES area, can you conclude anything here?
The way I see it is that someone has to go first with these policies. And it might as well be a place where it's most feasible. And so, yes, the prevalence of smoking, the Henriksen paper looked at, it is lower in Beverly Hills and Manhattan Beach than it is in California overall. And in California, it's the third lowest in the country as far as states go. So we have already two levels of an uncommon willingness to control tobacco. And yes, a lot of financial resources. I think the generalizability is limited, but I hope that other areas won't necessarily take differences that exist between them and Beverly Hills and Manhattan Beach as reasons not to try.
So maybe if I could add just one more point about that. So this doesn't get to the generalizability specifically, but I think that there is internal validity, even though these places are different. We fully recognize that Beverly Hills and Manhattan Beach are not typical in any way, but I think the SDID procedure is designed to match those cities to other, a comparative group that looks more similar to them. And so that's what we tried to do in terms of estimating the changes. So it's not comparing Beverly Hills to all California cities. It's matched a weighted comparator that sort of more resembles them.
That's a great point,
And
Justin.
was it true in your results that there was a ramp up pre-policy in terms of sales?
Only in grocery stores, and to Justin's point, I think it was 250 and 300 respectively, something around there.
Yeah.
Cities contributed stores with positive weights for the synthetic controls. So the sales trends that are being observed in these cities before the bans were similar to sales trends observed elsewhere in California at that time period.
And just one other point to add about generalizability, particularly Manhattan Beach, but Beverly Hills to some extent too, is while the residents of those areas are definitely higher income, a lot of the people who work in those areas are from the service industry and are a little bit more representative of lower and middle incomes. So that's something to consider about the impact on those populations who typically buy their tobacco products, on their right after they get off their shift, before they go home, where they work, even if they're commuting a distance to get back to their residential community.
Can you speak a little bit to the public health implications of something like this, where they choose to ban both combustible tobacco and other tobacco products? So, if you're in the kind of harm reduction camp, you might think that this is not obviously good because some people would have difficulty substituting because e-cigarettes are no longer available. Just from a policy design point, can you comment on that?
Yeah, so I think it is seen as the fact that the policy doesn't cover a broader geographic area, I think allows for individuals who take a harm reduction approach to their tobacco consumption more feasible. These are relatively small cities. You saw what large geographic areas were covered by the half hour, and that's the average commute for both those cities. So that's not like an unusual amount of driving for people who live there. And so it may be marginally harder to obtain products that might be less harmful, but it's the way this is structured, it's, I think, a relatively low burden.
But that speaks to the scalability of the policy, right?
It does, but I think future policies will have to address that in a way that this one, because of how it was designed, does not.
Right. Right.
They sort of kick the can down the road on that one because
Yeah.
it was immaterial.
I don't know that much about Los Angeles. Maybe Adam can comment on this, but one question would be, it would be kind of nice to know where these service workers are commuting from, to kind of think about um, characteristics of those people, to think about the representativeness and the external validity.
Yeah, I don't have any specifics, but just my guesstimate is just a broad.
Right.
Yeah,
Right.
this is the most heterogeneous population in terms of county
Yeah.
wise, I think, that exists in the country, or one of them at least, and of course the most populous. So it's unique in some senses, but yeah. So I'm not really sure, but some of us do commute, an hour each way from work, or even more. Me
Right.
not included, luckily.
And we do have demographic characteristics for the treated cities, their synthetic controls, and also the entirety of California. So you can compare how much Beverly Hills and Manhattan Beach are similar in that regard to places from which we drew sales data and the state overall.
So one of the things that I'm interested in these kind of contexts is the supply response, the industry response. So, there's a tobacco control policy that's put in place, and industry responds in some way that potentially undercuts that response. In this context, it's such a small area, as you've mentioned a number of times, maybe there's no industry response. But if you tried to scale this, like, there's a producer of cigarettes, right? And they might behave in fundamentally different ways. Do you have any ideas there?
Well, I'm sure they will pull from their established playbook to address the economic concerns that would come with the restriction of the sale of a highly lucrative product. But as a public health researcher, and specifically someone more on the epi side than the policy side, I'm really more interested in what this could do for people's health. Maybe Justin, you might have, because I'm relatively new to tobacco control. As was mentioned in my introduction, I came from the cancer control space. So Justin might be a bit better equipped to
So
address that.
one thing I would mention is one of the earlier studies that Nita had mentioned by Lisa Henriksen and colleagues. They did, I think, also look at pricing of products in the surrounding areas to try to see if there were shifts there in terms of discounts, for example. And my recollection is that at least maybe within the immediate surrounding area, there weren't big shifts in price after the bans went into effect. But that would be sort of like one study to think about. But more generally, I think you're right that there clearly could be supply side responses to these policies if they were scaled, and that is something I would expect. And I think it depends a little bit sort of on the if other places don't adopt the policy exactly how Beverly Hills and Manhattan Beach is, that could also make a difference in terms of the types of products that get substituted towards and those sort of substitution patterns.
Yeah. One question that came in, just thinking about concurrent policies. So regarding Beverly Hills, there might be there are bans of smoking outdoors unless you're actively walking, bans in parks of smoking, things like that. Are you worried about any kind of contamination or of concurrent policy changes during this period?
We incorporated the flavor bans but not other policies, yes, into the analysis. The way I see those, and maybe Justin, you have something that you can add, is that places have their own cultures surrounding tobacco consumption. And so Beverly Hills and Manhattan Beach have already positioned themselves as cities that are not favorable to tobacco use. And maybe places that don't have such stringent regulations will find this more difficult to implement, but I'm really excited to see, hopefully other municipalities will follow suit and we'll have more data to study how this operates differently in different places.
One thing to piggyback off of that, there was a question about whether or not you could get data on cigarette tax revenues. I don't know if you thought about it. Maybe you can comment on that.
I
So
think
I can maybe jump in on that. I didn't actually, I haven't seen exactly where that is, but I believe at one point we've been trying to look at revenue data, and I think it's really hard to get at the local level within California. So yeah, that's something that would be interesting, but I think is not available based on the way that it gets collected.
it's a state level tax. Like there aren't necessarily local ways of splitting it out. Is that, do you know, Justin? If that's part of the problem that you can't, because we had store addresses, which was essential for the feasibility of this analysis, but a lot of data exists without geolocation information.
Yeah, I mean, I think the way that it gets reported to the California Department of whatever it is, tax and finance administration, they don't have local data that they can provide.
Another thing that's come up, it's not just service workers. These are highly touristy areas as well. So you have huge numbers of people coming to these areas, don't live there, and are not working there.
Beverly Hills did plan on an evaluation 3 years after the policy, though I've yet to see the results of it, on the effects on tourism. So it's something that is on their radar. But again, as mentioned, these are small places. It is not overly burdensome for people to go to a neighboring area and purchase tobacco, should that be their choice.
I think that Michael, you brought up this point though about like the industry response, and I think that's something really important to think about, right? And kind of like do the thought experiment. And I guess I haven't been following like most recently, but I've heard that, some of the bigger tobacco companies have been investing in cannabis, right? And so, I mean, that's one thing to think about if there is some sort of like a substitution effect and there's more marketing, how do we think about that as a potential consequence? Certainly relative to combusted tobacco, I think that some of us might feel that that's not the worst trade-off, right? Um, but it's be interesting to think about and study and to what extent are the kind of the bigger tobacco industries if we're like a large county or states were to start doing this, right? You know, are they going to think about alcohol? I'm not sure. Or of course potentially new psychoactives that would be outside of the jurisdiction of tobacco enforcement.
Okay, so any other questions? So I think there is broad interest from universities and agencies in studying these things. I think my I guess my overarching question for you for both of you is this, this is kind of the logical end of the kind of tobacco control policy spectrum that we've seen, right? We have flavor bans, we have much higher taxes, we have indoor smoking laws, but this is just outright banning it. Do so have there been it seems like litigation is going to come in at some point about this, right? And maybe can either of you comment on kind of what that looks like going forward as we scale these things to larger areas, or we try these things in bigger areas? I mean, is this just going to get struck down?
So I'm not an expert on this, but I do think that was initially a concern that Beverly Hills had. Sort of we're talking with their city lawyers about whether or not it would pass muster or not. And I think neither of these cities, to my knowledge, have faced legal challenges. The thinking is that because it doesn't discriminate against certain types of products or certain retailers, it is sort of across the board that the bans that it may actually be legal to implement. But clearly, if it got scaled up, maybe there could be legal challenges elsewhere. Yeah.
We can't hear you, Nita.
The legal challenge that comes to my mind immediately is the ceremonial use of tobacco by American Indians and Alaska Natives. But let's see.
Kathy makes a good point in the chat. It's not a ban on smoking; it's a ban on the selling in a retail environment, which
What,
which brings back the question about black markets and illicit activity. But Adam,
oh, I was gonna say, well, like, do we know anything about those dry counties for alcohol and how the alcohol industry has responded to those?
well, I think there's a large literature on that in the economics literature. I mean, the obvious comparison here is prohibition of alcohol, right? Which didn't go particularly well. But
Also happened over 100 years ago when things were harder to regulate.
Yeah, it's
But
very difficult to understand how that would relate to now.
and
The
also a product that doesn't directly harm people who are not consuming it like secondhand smoke does. But
well, I mean, there's lots of
I
second
think people are
effects of
responsible for their
alcohol,
behavior when
right?
consuming alcohol. But anyways, it's not the product.
Was there an uptick in sales in the cigar lounges that were able to stay open? I guess that must be yes, because you found that, and there were some that were allowed
We
to
did
grandfather
not
in.
have data from the cigar lounges. And so, because those are small independent stores, those do not feed into Nielsen. The
But you found something on
increase in
cigars, didn't you?
cigars, yes, was in the border area. And I suspect that reflects a relatively inelastic demand for that product.
Right.
I think people who smoke cigars are going to smoke cigars.
And those are, like, or Nita, those are like large cigar, premium cigar retailers, or would this also include like the small cigar, little filtered cigars and things like that, cigarillos?
I'm not sure what products, if you're asking,
It does include little cigars and cigarillos as well. Yeah.
but do you know anything, Justin, about if there's any restrictions on the products that can be sold by the 3 exempted locations?
I mean, they can only sell cigars, I believe.
Yeah.
And yeah.
I don't know if they specify whether cigarillos are.
Oh, I see. Yeah, I'm not sure. I imagine not. I mean, they tend to be, I think premium cigars are what gets sold there.
All right. Well, thank you so much for a wonderful presentation. It's very interesting work, and I applaud the publication. So we are just about out of time. We're going to kick it back to Brad to take us out.
We are out of time. Thank you to our presenter, moderator, and discuss it. Finally, thank you to our audience of 135 people for your participation. Have a top-notch weekend.